So hello everyone, in this video we are going to talk about what is the basic difference between a homeopathic practitioner and practitioner of other medical schools. For example, allopathic or Ayurvedic practitioners. So we are going to take the reference from this book, The Art of Case Taking by Dr. P.S. Smith. So what makes a homeopath different from other doctors or other practitioners of different schools? So the basic difference lies in the diagnosis. When you try to read this book, you will find in the last few chapters that the basic difference lies in the diagnosis. So what diagnosis? So there are two type of diagnosis. One is clinical diagnosis or nosological diagnosis that gives your clinical condition or your disease a proper name, and the other is therapeutic diagnosis. Means a diagnosis which gives the physician an idea of what medicine should you get to treat this clinical condition. So there are basically two type of diagnosis. When you go to an allopathic practitioner, he will do clinical assessment, he will study some biochemical reports, and he will also suggest you some tests, and on the basis of all these he will give a name to your clinical condition or a name to your group of symptoms, and that is the clinical or nosological diagnosis, means giving a particular name to the clinical condition from which you are suffering. So this is the basic fundamental work of a allopathic practitioner, and based on the name of this disease he will give you a specific treatment which is specific for that disease or for the name of that disease. But just think over it, just think a minute. Do all persons having typhoid fever behave in the same manner? Do all persons in the typhoid fever have same level of thirst? Do all persons in the typhoid fever, they have all the symptoms which are in the clinical diagnosis of typhoid? So the answer here is no, because every individual is different, and when you go to a homeopathic practitioner, he will ask you few questions which is directly related to your behavior. So by asking these questions, he is trying to assess the behavior or personality of this individual, and based on this behavior, based on this personality, based on his unique peculiar characteristic symptoms which are present in this individual along with other symptoms of the disease, he will ask you certain questions, and based on these questions he will get upon a remedy which is suitable to treat this patient, and this is known as therapeutic diagnosis. So these two type of diagnosis is the basic difference between a homeopathic and an allopathic practitioner, and this is according to Dr. P.S. Smith. You can study more of this by just reading the chapter from this book, and this is a very good book if you want your homeopathic practice to be good and your case taking to be excellent. Thank you. So we'll meet you in the next video. तब तक के लिए bye bye.